It reduces the amount of data to be collected to really 6 main key performance indicators. The benefits are that this is a national audit and that reporting on these KPIs and the production of reports describing the patients on biologics will be the first concrete example for local teams of a genuine quality improvement benefit of the registry. This autumn is quite a landmark for the registry in that the first iteration of quarterly reports is being sent out to teams. I think patients would expect local teams to have a live register. They would expect teams to know how many patients are treated with potent agents and to follow up outcomes. And I think what the registry is offering is patients a sense that their journeys are being tracked, that the appropriateness of their treatment is being monitored, and that their outcomes are being captured and used to drive quality improvement and to support safety. I think one of the major strengths and achievements of the registry is to have obtained permissions to access routine administrative data for hospitals and HES data, and also to link that data to registry records. We've worked quite closely with clinical colleagues, we've shared reports, and I think we have a suite of tools now to interrogate the HES data in particular, to identify key milestones in the IBD journey, but also understand where selected items of registry data really add power to those analyses and provide more insight. So you simply record a drug date and we can access hospitalisation, A&E attendances, surgery, admissions for infections, a whole range of metrics we're developing to provide that linkage benefit. The registry has provided a really exciting platform for research, both for local teams wishing to set up research studies and for multi-centre and potentially national scale research. The registry platform is already supporting a number of observational studies and there are more coming on stream. The advantage, I think, of the registry platform is, well, there are multiple advantages. One is that we have a defined data set. We have an infrastructure for collecting data, and that simplifies research. It also means that centres, perhaps that don't regard themselves as set up to undertake research, have a vehicle, a platform to collect the data. They have the data set ready. So this allows people perhaps to think about the first opportunities for research participation. And of course, in terms of intervention research and comparative effectiveness, this is a platform for clinical trials. The key thing is to have a plan and a sense of what you want to achieve as a team. That may vary quite substantially between different sites. The focus we took was that we really want a live register of biologics patients. It's small scale enough to think about capturing a denominator population, a genuine full capture of those patients, and think about how you would flag those patients for entering them into the registry. You may not be able to do it live in the clinic, but have a system whereby you start to build that register.